Hey everyone, Pauleen Lee here with WCCO. We are outside Abbott Northwestern, where if I point right behind me, you can see those coach buses here. They're getting ready to turn into Abbott Northwestern. So those buses, that's about the fifth one that we've seen so far this morning, turning into the hospital system. It's carrying about hundreds of traveling nurses to fill the void as the Minnesota nurses get ready for day 2 of their historic strike. As you can see, they're right outside, right here, right outside the hospital, setting up as they get ready to hit the picket line this morning here. So day 1, it was full of momentum, and the nurses are hoping to continue that momentum into day 2 here. Still though, no signs of negotiation continuing, at least not during this strike. So we've talked to Illini nurses. They say they're sticking strong to their 2 main sticking points of this negotiation. They want higher wages and they want more staffing. So in terms of higher wages, they're asking for about a 30% increase over the course of 3 years. Hospitals are countering though about 10 to 12% over 3 years, saying what they're asking for is just unreasonable, citing hundreds of millions of dollars of losses during the pandemic. So they're saying it's not possible. They can go 10 to 12, but that's about it. And so nurses, they will continue this strike. The nurses that we met from Illini yesterday outside United Hospital, they had said that they had reached out to the negotiating staff at Illini, hoping to continue these negotiations in an effort to come to some sort of agreement, maybe ending this strike early. But they said they did not hear from Illini. We heard from Illini. They sent us a statement saying that they would be ready and willing to head back to the negotiating table after this strike is over, which in some cases, I mean, at this point, the hospital systems affected by this strike, they've already bitten that bullet, right? Taking that economic hit, busing in these traveling nurses from around the country, paying them more than they do their own nurses. And these traveling nurses are here to work for a set amount of time. So that's already been figured out. They've already had to reschedule some elective surgeries and some other procedures that are not necessarily seen as imminent or they have to happen right now. So those have already happened. So at this point, hospital systems are saying, hey, you know what, let's take the time after the strike. Let's come to some sort of resolution that we can all agree on and take that time after the strike is over, because they've already had to bite that economic bullet here. Nurses, however, say, you know, the traveling nurses, they can help fill that void. And we saw that during the pandemic too. I mean, traveling nurses, they traveled the country helping healthcare systems that were really impacted, hit hard by COVID. And that was great. But traveling nurses don't necessarily have certain skills that regular nurses have, in terms of they can help provide medical attention like all nurses can. But nurses here will argue that they've been here for maybe months or even decades. And even if they're only here for months, that's more months than these traveling nurses. They've learned these hospital systems ins and outs. They've learned how their floors work. They learn how their departments work. They know all of the policies. They understand how to take care of these patients, especially the ones who are here for long periods of time, and they understand this community because they are part of this community, and that is all part of healthcare here. So that is what they're arguing. They would rather be inside taking care of their patients, but instead they are outside. They are fighting because they say at this point they really had no choice. So day 2 of strike, of the historic strike, getting underway relatively soon. As you can see, they brought the U-Haul truck out. They're bringing out the signs here. They've got the tent set up. 15,000 nurses from the Twin Cities and Duluth getting ready for day 2 of their historic strike. For now, reporting outside of Abbott Northwestern Hospital, Pauleen Lee, WCCO 4 News.